Hello everyone, my name is Dr. Brian Shiduli. I work with Equity Afya Kakamega. We are located next to Adia Center within Kakamega town. So today is World TB Day, and we'll be sharing briefly about tuberculosis on a few basics that we should be aware about. So we'll start by definition of TB. We look briefly who is at risk, and then we share briefly how would you know that you have TB, and then we know how you can have investigations done, and lastly we'll see how you can seek for treatment in a facility. So TB is actually caused by Mycobacterium tuberculosis complex, which has many species of those bacteria, and the way we acquire it is through inhalation. And then when you inhale that is contained the bacteria, it gets into your lungs, and within the lungs we have the immune cells, which are called macrophages. They engulf that bacteria and they form what we call Ghon's complex, which then is taken into the system. So it goes into two phases. We have the latent phase and then the active phase of infection. So if you get TB, it can affect any organ of your body. It can affect the lungs, it can affect the bone, it can affect the reproductive system, it can affect the teeth, it can affect any organ. But most of the time, we usually talk about pulmonary TB, which is TB that mostly affect the lungs. So if you have pulmonary TB, you're likely to present with the following symptoms. You will have a cough that is productive. When you say productive cough, is a cough that has sputum, and most of the time this sputum will be blood stained. It contains some blood. And then you're likely to have night sweats as well. Then you're likely to have significant weight loss. That's to mean you lose more than 10% of your total body weight within a span of 3 months or less. And then you are likely to have generalized body malaise as well. And then you can have fatigue. Sometimes you can have also associated poor eating and appetite. And then if you present the severe signs, you might have even difficulty in breathing when you have this disease. Then most of the time it will affect people who are immunosuppressed or immunocompromised. The immune system is low because of one or two reasons. They are on medication, they have another pre-existing illness, or they are on cancer treatment, such kind of things. Or those people who stay in crowded places that are not well ventilated, like prison places, schools, those people that if there's a bacteria in the environment, might not be easy to get out, so you get contaminated, then people are exposed to get the disease. And then the other group of people who get the disease are we usually call them the homeless people, who are maybe in the streets, people who don't have a place to stay, they have very poor housing conditions and so forth. They're likely to get the disease as well. Now, if you suspect that you have the above symptoms, we recommend that you seek attention, healthcare attention. When you go to the hospital, we'll be able to carry out some tests to confirm that you have this disease or not. So the basic one that we do to confirm the diagnosis is we will take a sputum sample and we take it to the laboratory for analysis. We shall do a test called GeneXpert and microscopy. That one helps us to identify the bacteria that is in that sputum. Then it will tell us if it's TB related or not. Then number two, we can also send you for a chest x-ray, which will show some features. When you look at it by an expert, it will tell you this is looking like it could be TB. So we usually send for those two tests most commonly. Though, however, right now we have other tests that can be done. We have something called urine lipomannan. We take your urine sample, we test for even the TB in your system as well. But those two are the most common ones we use to make a diagnosis of TB, plus the signs and symptoms that I already mentioned. Yes, so we have two things we need to do. One, we have to prevent the disease. For prevention, we encourage people to be vaccinated against TB. That's why you need to have a vaccine called BCG on your left arm. And those healthcare providers, so encourage them to have even extra vaccinations as well. And then for the treatment of TB is a bit extensive. You are treated for TB for 6 months. The first 2 months we call them intensive phase. Then we have a continuation phase for the other 4 months. We do 2 months with some particular drugs. Then you have other 4 months for the remaining duration of drugs. And then after that, we have to recheck again to see if you still have active TB or not before you stop the treatment.
Okay, thank you very much. What can you advise the audience out there about how they can carry out themselves on this disease?
So for those who are working in highly places that are at very risk, you need to make sure you wear protective gear. Make sure you put on your mask if you are in a hospital setup where there is a likelihood of getting a TB. And then those who have not been vaccinated, those who are young, encourage your children to go get vaccinated as soon as they're born to prevent them from getting the disease later on in life. And then if you notice you have any of the symptoms of said, it would be good to seek attention early before the disease progresses to a stage that will not be able to be treated.
Okay.